Global partnerships in brain research are absolutely essential for the patient community and for society as a whole. The burden of neurological conditions to patients, families, to caregivers, and to the broader society is huge. We are only beginning to understand the absolute burden and the impact at this present moment in time. A huge amount of data is still needed to be generated for the neurological community, and we can gather a huge amount of insight from the research community and from our fellow patient organisations and clinical experts across the globe. So the type of information that the Brain Health Atlas generates at both the local level and at the global level is a critical starting point for policy and advocacy actions. Without understanding or having any concept of what the burden and impact is in a given region, you can't advocate effectively for services and supports, for investment into therapies that are needed, and to safeguard the future for all generations. We do know that 1 in 3 people live with a neurological condition in their lifetime. So it's important that we keep monitoring this, that we continue with this data generation, and that we can utilise it most optimally by sharing it broadly. So in addition to what I've mentioned around the benefits of having incidence and prevalence rates to start your understanding of the burden and impact of a condition in a given region. For individuals, it lets people know that they're not alone. It lets people assess and analyse what their position is within the broader neurology community. You can compare one condition to another. You can also look at what's happening in different regions that may be different to what's happening in your own region, and trying to understand if that's having an impact on the number of cases of a given condition